Hello, I'm Noopur Raje. I am from Boston, Massachusetts. I direct the Multiple Myeloma program at the MGH Cancer Center in Boston. We're very excited about the new approval of a first-in-class cellular therapy product, the CAR T cells with ide-cel. This is also now known as a BECMA. This was approved late March after a lot of work which has gone into developing cellular therapy for our patients with multiple myeloma. The question often asked is when is the right time to discuss CAR T cell approaches with a patient with myeloma. And I would just flip that around. I think our patients are asking us about CAR T cells all the time. But to start out, I don't think it's ever too early or ever too late to talk about CAR T cells. And the reason for that is what we have seen with the data which has come out of CAR T cell therapy right now is very high response rates in very heavily pretreated patients to the tune of getting minimal residual disease negative situations in patients who've had everything available to them for their myeloma, including an immunomodulatory drug, both immunomodulatory drugs, both proteasome inhibitors, as well as a CD38 monoclonal antibody. Now, conventionally, this is a very challenging patient population to treat. If you look at the old data, most of these patients will respond to newer treatments, but that response is short lived and does not exceed anywhere between 2 and 3 months. And typically, the survival of these patients can be quite low. Now, with cellular therapy, this is the exact patient population that we've treated, and this is the exact patient population which has now been approved for the treatment with a cell therapy product such as a BECMA. So you have to have had more than 3 prior lines of treatment, have to have seen both immunomodulatory drugs, both proteasome inhibitors, as well as a CD38 monoclonal antibody. The reason I say it's never too early to talk about CAR T cell therapy in this patient population, so not just in an approved setting that you can offer patients CAR T cells, but we have a whole host of clinical trials where we're doing CAR T cell therapy early. We're doing it in high risk patients. In fact, even instead of an autologous stem cell transplant, we're doing it at first relapse following patients who relapse post an autologous stem cell transplant, relapse occurring within 1 year of this. And that is the reason why it's never too early to discuss this. There's a whole host of clinical trials available. There's the drug product, which is available as standard of care. And part of the reason to discuss this early on in the course of a patient's myeloma is it does require things to be done in terms of logistics, that is, saving a spot for the CAR T cells, planning some kind of bridging therapy for patients with CAR T cells, and so on and so forth. So I think the future is really bright with CAR T cells, but the earlier you sort of have this discussion with your clinician providing care, the easier it is going to be to incorporate this into the paradigm of your myeloma care.